The benefits of chemotherapy. But you never see a slide like this today, Ken. Chemotherapy drugs. Chemotherapy drugs are powerful, effective cell-killing agents. They are. They really are. We know that. And the problem areas in cancer chemotherapy is that an adequate intracellular dose intensity requires high doses of drugs in the extracellular space. Means you have to give it, either frequently. Most of it's done IV. So you give high doses IV in order to be able to create a sufficient concentration in the extracellular fluid. So by mass action, you can force the diffusion of these drugs through the cell membrane into the cell. You need to get a certain intracellular dose intensity. That's the term they use. In order to be able to affect what it is that the anti-cancer drugs do. And unfortunately, there's a lack of tissue specificity for the drugs, so what happens is that this affects all the drugs, all the cells in the body, and all the rapidly dividing cells, where you see hair follicles falling out, and you see GI problems and bone marrow suppression, so the tissues that are characteristically involved, although there's a lot of other toxicity that can happen for other metabolic reasons, like neurologic stuff. The bottom line is 1 and 2 gives us widespread dose-related drug side effects, which makes chemotherapy the treatment that's worse than the disease. People really fear chemotherapy. I know that, and I'm sure that a lot of you know that as well. And that's why this treatment is really such a gift.